What's going on, everyone? Dan Julian here, nurse practitioner for Dan Aesthetics Medical. Today we're doing a little Instagram Live, nothing crazy, just very simple and relaxed. We're going to be inviting Brittany Wilson, another nurse practitioner with 12 years experience. She's working from Maryland, and basically she has her own practice, Ray Aesthetics, and she is a national speaker with multiple medical aesthetics companies. She's worked with renowned plastic surgeons and physicians who are aesthetics providers. And we're going to be talking today about what's trending in 2024, what we feel is a hot topic. And we're getting constant questions about this. A lot of people are asking us, do you carry these products? What do you think? And I'm like, you know what? Let's just talk about them and go over this live with you guys in real time. And at the end, we're also going to talk a little bit about Patreon. If you are a medical aesthetics provider wondering about it, wondering if it's right for you, we're going to talk a little bit about it because we both have one and just share thoughts on it. So let me invite her now.
Hello, how are you doing?
I'm well, thanks. Britt, how's it going?
Good to see you.
Basically, I did a little intro for you already. I'm going to just do a little recap. So, Brittany Wilson, nurse practitioner from Columbia, Maryland. You've been doing this for 12 years. You know what you're doing. You've been working with plastic surgeons and physicians in medical aesthetics for quite some time now. Well-renowned plastic surgeons as well. At the same time, you own your own clinic, Ray Aesthetics, and you have your own Patreon as well, right? So, We're very cool. So today what we're going to do is we're going to chat about what's trending. You know, I'm sure you get questions. I get questions all the time from, our clients saying, like, what's this? A lot of people are talking about this. Should I be getting this? And these are good questions. And a lot of times people want to jump right on to what's trending. And for me, I'm always in tune with what's trending, right? So this is now we're getting to medical aesthetics conference season, I call it basically. You have MCAS, you're going to have AMWC, you've got one coming in Miami, you got a bunch of stuff coming in. And these are the ones that I go to because it talks about not only what's new now, but also what's up and coming. So it gives us an idea of what's out and if it's working. So today we're going to choose kind of like 3 things that we feel is working, or we feel that are going to, things that are going to be trending this year as hot topics. It doesn't have to be necessarily anything that you're even using. We just know that people are going to be talking about it. We're going to give everyone our take on it and basically, what we think you guys should be doing.
This is so good. And then we can say like out with the whatever 2023 and with 2024 if we like the trends.
Yeah, right. So, and I think that there are certain benefits of jumping on something that's brand new because, hey, it's out, it's either FDA approved or Health Canada approved, and basically it should be something that is safe and beneficial for clients. But the risk is that there's limited real world evidence out there, right? Which means that usually the studies that have been done are very select patients that are like perfect. They already have like pretty great skin, or they don't really have, many comorbidities, no diabetes or anything like that. And it's just like the perfect candidates. Like if you are in my study, things are going to work out perfectly. But when it comes down to real world experiences, this is where people come in and they could have a whole slew of comorbidities, and at the same time they may already have a lot of damaged skin, and at the same time certain things might work, but often enough for these clients you're probably going to have to do like a multimodal approach where you're going to have to do a combination, right?
Aesthetics in general though, right? Like there's such little research sometimes, I think we're getting a lot better. I used to do orthopedics, and I will never forget the orthopedic surgeon. He's so funny because I used to do half plastics, half orthopedics, and he was like, yeah, you work with the wild, wild west over at the plastics. I'm like, why do you say that? He's like, because there's so much like little evidence. It's not as like clean cut as orthopedics. We know this knee replacement, this cut. We have 1,000 studies on this. Johns Hopkins, I worked at for a long time, and very evidence-based research. And then, but I've always told him, I'm like, that's a side that I love too, is the plastics, where it's a little bit more of an art form, and some things work for some people and some things don't work for others. And you really have to learn people's preference to people, what they're looking for, right? So it's all about assessing the patient, listening to the patient, hearing what they want. We had to do that in orthopedics as well, but I think it's a little bit more of an art form in aesthetics.
It is an art form, and it's also, even the presentations on stage are a little bit of an art form. You know what I mean? Like it's and that's the difference. So for you, that was your background. My background was infectious disease, so very dry, like HIV, hepatitis C, hepatitis B, and stuff like that. The conferences there to here, this is like a rock star show. You go here and you're like lights, and everyone's on stage, and everyone's
it's so funny. And the first time I went to an aesthetic conference, I was like, where am I? I have like nothing brand name. I was still in orthopedics. I worked with like men half the time, I'm like, oh, this is a whole different world. So
I know. Well, we're here, and at least I find like last year they're really starting to push that. Hey, we need more evidence base.
yeah,
So, which is great. You know what I mean? I'm really hoping for more of that and less
same,
showy stuff, more kind of like, hey, this is actually what's working,
same.
and this is science. So it's cool. Like right
Yeah,
now, for most of us, like we're doing a lot of injectable stuff plus like some energy devices. So this is what we're gonna kind of like focus on, right? I'm gonna let
say
you choose your like number one. What do you think
I
is
was,
like a
well,
trend?
I have a theme of 2024.
Yeah.
So my theme of 2024, even though I train for a lot of injectable companies and love filler, but I'm kind of steering away from less filler. I'm
Mm.
doing, hopefully we all steer away from filler face, right? But like, what can we do multimodality to make a really nice refreshed look for these patients and really giving them the expectation this is not going to be a one and done. Like I have some people that travel to me, I'm like, I'm not doing all of this filler like 10 vials or 10 syringes in one day. So I love my local patients that I can just treat. I see them every 3 months for their tox, and then we have a whole plan. And a lot of my plan always starts with a Sculptra. So I would say I think that caught on really heavy in 2023, but I think in 2024,
Yep.
I really believe that Sculptra and more biostimulators are going to come on the market. Diluted Radiesse, hopefully there's going to be more studies like evidence-based research about around those two different biostimulators. I'm really hoping for another one to come on the market because I just think it's such a good tool that we have in our toolbox instead of just hyaluronic acid, fill, fill, fill,
Mhm.
fill, dissolve, 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 fill, fill, fill.
You know, I think a lot of our viewers are probably kind of a mix of providers and also people in the field who
Yep.
are just like general clients who are not really super versed. So like basically hyaluronic acid, it's a gel, it fills, usually if you're going to use it, to replace lost volume. The benefit of it is that it's going to restore anything that has lost volume. So if you lost fat in the mid-face or temples or anywhere where we start aging, it's part of the aging process. If it's done tastefully, it's amazing.
Yeah.
It gives you just the right amount of volume you need, and your body recognizes it for the most part because you make your own hyaluronic acid. This is a synthetic version. People rarely have any side effects with it. And if you don't like it, you can dissolve it. The issue with it is that what's really nice is the first one or two or even maybe three times you use it, it's great. It's just that after you use it maybe the third or fourth time, then what happens is, yes, it tends to hold on to its form based on, whatever way that it's holding its jelly, whether it's a BDE or a Vicross or
Mm-hmm.
whatever. It holds together for about a year and a half, and then after that, it kind of dissipates. But it stays in the skin. And it stays in the skin and it hydrates it. And it stays there for, who knows, maybe ever. And that's fine because it's hyaluronic acid. It's just that if you're doing it too much, too often, then eventually that hydration builds up, and then all of a sudden you might look
For
puffy and
puffy.
watery. So now we have things like biostimulators, right? Biostimulators just a fancy word for basically stimulating collagen. You're telling your body, hey, by the way, make collagen. I'm going to piss off this area, and then your body's like making
Yep.
irritation, and it's going to
Inflammation
make collagen.
process.
And we have right now two that are really well known, which are Sculptra and Radiesse. And you're
Yep.
talking about taking the Radiesse, blending it down, making it something very similar to Sculptra, just in a
Yep.
different form.
And I think, don't get me wrong, love hyaluronic acid. I think when I was injecting 10 years ago, what did I do? Every year, my patient would come back. Oh, they need cheeks because the manufacturer says that it only lasts for 1 year. And it's cheek filler, cheek filler, cheek filler. And we didn't think about balancing everything. And I think
Mm.
we're just so far in aesthetics. We have come so far in balancing, facial balancing, looking at all the proportions. If we're going to do lips, we need to do chin. We need to do piriformis aperture. And then at the same time, we also need to support. I really like my biostimulators almost posterior and lateral. And then I always say like my hyaluronic acids are more medial because lips, obviously you can't do a biostimulator, nose and tear troughs. Those are like my go-to. And I love my biostimulators for the temples, preauricular. It's like Sunday night. Look at me. I'm like, I haven't spoke my aesthetic language in 2 days. And
That's all good. So
yeah.
for people who aren't aware, why don't we just use biostimulators then all the time?
Great question. Not as predictable. I can't get the same sculpting, right? So if somebody like really wants that chiseled cheek or somebody really wants that chiseled jawline, you can do it with Radiesse.
So why would you not use Radiesse then?
Because I do think that Radiesse can build up. Risks involved, right? Vascular occlusions, very hard. Can't reverse it. Long term And
Tim Pierce posted recently, he's like, I don't trust anything that's not HA. If it's going to be like as a volumizer, he said he would never inject it. And I still feel there are a lot of providers like that. And it's a good point. It makes you kind of question, you know, you have to be like, I know my anatomy like the back of my hand, but even me, whenever I'm injecting Radiesse in pure form, it's actually pretty rare that I do it actually in its pure form. I usually always blend it with a little bit of HA to give me that leeway, just in case if it's not perfect. And that has nothing to do with the vascular occlusion.
Yep.
That's just in case if it doesn't turn out perfect, because we're not robots.
Exactly.
We are trying to make perfection, and you'll have a client that this was perfect, and the other client, they'll come back like, well, this is a little too much, and you have to partially dissolve it. We're not robots. Everyone's body is going to react a little differently to it. Yep. And also Radiesse tends to swell a lot. It's not a perfect molecule. So what do you think is going to be instead for, 2024? Do you still think Sculptra or maybe hyperdilated Radiesse?
I think Sculptra. I just think they have such a good momentum. They have so many great studies. I think that Radiesse is beautiful. I think it's a great product, but for the face, I still just go to my Sculptra because it gives that glow. I've played with diluted Radiesse. It's funny, I have my places for diluted Radiesse. I like diluted Radiesse on the neck a little bit more because I don't dilute it as much. I make it a little bit thicker so that some of the crepey skin, and so they get that, it's like a little bit instant result. So it's almost like a mini fill with the biostimulator effect. But you're exactly right with the face. I just like, I just like my Sculptra.
I'm going to tell you what I think might be trending as a trend for 2024. So with hyperdiluted Radiesse, what providers are starting to notice, and the reason why they're going with that instead of Sculptra. So Sculptra, by the way, it's basically a powder, and it's like crushed up dissolvable sutures. And what you do is just mix it with either saline or sterile water. You inject it usually in the fat pads. You can go deep if you want. But then after that, you absorb all the water overnight. You're just left with this powder that causes an irritation. You can do that with Radiesse. But going back to Sculptra, sometimes it doesn't work for all clients. Sometimes if you have micronutrient deficiencies, vitamin deficiencies or something like that, then it might not work for you, or you might not be getting the same collagen stimulating results, right? So what people are starting to notice is they're like, well, what can we blend that with? And there's actually a really interesting study that Shino Bay is actually working on. And what he's doing is he's taking hyperdiluted Radiesse and he's mixing it with an unchained hyaluronic acid, which is called NCTF Boost. And this stuff is basically blended. Yeah, you blend it, and this stuff it's unchained, right? So it's just like hyaluronic acid, almost similar to HA, almost something like a skin booster, but it's mixed with vitamins, coenzymes, and antioxidants. So it's basically giving you the nutrients that you're missing. So people who are vitamin or micronutrient deficient will take that instead, and they'll have a better collagen response because it's giving the nutrients that are required in order to stimulate that collagen response.
That's really neat.
And it's very cool. And it's something that I've dabbled a few times with. It's very much off-label, but it's giving great results.
Now, you're doing that more of like a wash, like how you would use it? Same way.
Same way as, so I do it with the neck and I do it with the face. So it's very similar to if you're going to be using Sculptra, right, in the subcutaneous. But you can do it with the neck too. And what's nice about it is you get that immediate glow that you're kind of maybe missing from the Radiesse compared to the Sculptra. And it's almost, there's not enough evidence to support that it's a guarantee, but it makes sense. Like you're giving everything needed, right? It's kind of like neuromodulators and saying, well, you can take zinc and it's going to increase the effect. Zinc is only going to work if you have a zinc deficiency. If you have the zinc deficiency and then you take zinc, your neuromodulator is going to last longer. But it's something similar to that, right? It's not going to maybe make a dramatic effect for everyone, but people who are missing something from Sculptra, maybe can try that out. And I think that's going to be something that's pretty cool and pretty neat.
Have you heard of doing the microneedling with the Sculptra?
Yeah, I've heard about it. I haven't done it, and I think the reason why is because whenever I tell clients the price of it, I'm like, you have to charge the same price as your Sculptra, and they're like, no.
I know. I did it to myself, and I've done it to some of my staff because that's how we always start with like cowboy stuff. I'm like, we're all starting with us. And it was great. And I had the glow. We also did it with diluted tox as well, super high dilute tox, just for like those really fine lines. Beautiful outcome, not super long lasting like we thought, but we all did it probably like maybe 2 months ago, and we could see a difference. But then again, we also bought the Moxie, which I think is amazing, that complements very well with the Morpheus 8. You know, you can have like your younger crowd, your older crowd. Tightening is your Morpheus 8. Your Moxie is more for like your pigmentation glow. I call it like a mini CO2, even though it's really not. It's not as like aggressive.
Is that one of your treatments for 2024 that you recommend?
I think so. Moxie's making a name for itself.
Yeah,
Sciton.
definitely think that if I think lasers in fact, just in general, are going to be definitely making a big comeback or, just a big step in for medical aesthetics this year because, it depends where you are. We're very limited in Canada with what we can do with injectables. And there was a couple of things that I want to talk about. We'll go into those too, but we don't even have them here. I wish,
Mm-hmm.
right?
Mm-hmm.
So what can we do? Like, if you're not a filler fan, then what are you going to do? Then you can rely on your skin. But remember, if you're looking for volume, if you have volume depletion, all these other things really aren't going to work. You really have to use some type of filler in order to restore that. And this is where I love your work, super natural, right? Fillers have a bad rep because of the providers that are doing bad jobs.
Agreed.
You can get, I tell my clients it's very difficult to find someone who you and I can see the difference. You walk out of here, we're both in love, like high fives, and you walk out and no one can tell. And they're just like, man, you look fresh. That's the secret. It's very difficult to find people who can do that. And as a result, fillers are getting a bad rep.
We'll never get rid of filler. I think it's just about educating the practitioners about how to use them.
That's right.
More.
Can't get rid of it. But if you're kind of like, well, I want to try something for the skin. Your choice for laser is Moxie. BBL.
Can I say Moxie Morpheus combo together with BBL same day?
Yeah, you can do that. You can say whatever you want.
With Sculptural.
It's Sunday night.
Okay, I got one more like icing on the cake for this combo. I think it's also going to be a trend. Would be exosomes.
Okay, exosomes, nice.
Yep.
So we have exosomes, love them. My take on exosomes is that it definitely works for us. Getting great results with hair. Like particularly if you mix it with a microneedling radio frequency.
Yes.
So if you mix that with your Morpheus.
See, I actually haven't done it with a radio frequency. I actually just did it with a skin pen.
So a lot of people will do it injections or they'll do it with like their microneedling pen or whatever. But do it with the radio frequency microneedling. So whenever you're going to that's the last 3 conferences I went to, people like, if you have a microneedling radio frequency device that can go on a scalp, you should be doing that with your exosomes. They're actually dropping their PRP for exosomes. And the reason why is because there's hundreds more growth factor there. They're getting much more consistent results with regards to the PRP. It's kind of like a hit or miss. Sometimes it works, sometimes it doesn't. They think maybe it's because people are, they have a better diet or something like that. But in the end, it's not the vitamins that are going to grow the hair. It's the actual growth factor. So there's something that's missing, but we know there's a ton more growth factor in the exosomes. Yeah. And exosomes, by the way, for people who aren't that, it's like a byproduct of stem cells. It's actually what we thought stem cells were like. The answer is actually the byproduct being released from the stem cells called exosomes. And that's where all the secret is. So yeah, it's definitely the only downside for it right now is that I find like it's a little bit costly. So it's something that you have to you're going to have to increase your price to make a profit for it. It's a hard sell, and it's something that you're really going to have to educate your client on it. And there are clients who are going to say they believe in it, and other clients like, I don't know if this is.
Because it's not that immediate sasatisfaction. That's why people love going back to filler. It's immediate satisfaction. Well, my little one's she's staring at me.
I know this is supposed to be like 20 minutes, 30 minutes, but it's gone pretty much an hour, and I appreciate it. Everyone, thank you so much for staying with us, and thanks for all the great comments. You guys are terrific. Happy New Year, everyone, and thank you, Brittany.
Happy New Year. I'll see you around for sure.
Take care.
All right, thanks, Dan.
See you, everyone.